Hello cruel world, my name is Dr GRANDE'S. I'm a consultant forensic psychiatrist and an NHS doctor. I assess mentally disordered offenders for a living so that you don't have to. This video that you're watching is my analysis of Dr. GRANDE'S analysis of Jeffrey Dahmer, specifically his earlier life events. So I'm talking about a video that Dr. GRANDE'S got up on his channel called "Did Jeffrey Dahmer's life experiences contribute to his killer status? Jeffrey Dahmer case analysis." I'll put the link in that video in the descriptions. So I'm kind of critiquing this video from the perspective of an expert witness who does these kind of assessments professionally. So to be specific, I'm looking at what factors, what character traits, what experiences, what scenarios might have driven or contributed to Dahmer's behaviours. So let's see how Dr. Grande did. Before I do that, very quick background of the case for context. I'm sure you know most of this. Jeffrey Lionel Dahmer, also known as the Milwaukee Cannibal or the Milwaukee Monster, he was an American serial killer and sex offender who committed the murder and dismemberment of 17 men and boys between 1978 and 1991. His case has been in the public consciousness a lot recently because of attention that it's garnered with the Netflix drama Dahmer, where Dahmer's played by 𝐏𝐬𝐲𝐜𝐡. Okay, let's jump straight into Dr. Grande's videos. As always, Dr. Grande starts off his video by saying, "I'm not diagnosing anybody, just a situation like this." Come on, Dr. Grande, there are no situations like this. Dahmer killed 17 people, cannibalism, necrophilia. Clearly, Dr. Grande, you're diagnosing Jeffrey Dahmer, which is fine. I think if it's for educational purposes, I think it's fine if we make it clear that we're doing it for that reason, to diagnose somebody. So just say that that's what you're doing. There's no need to kind of hide it in those statements. Don't piss in my pocket and tell me it's raining, Dr. Grande. Okay, so firstly, let's talk about what I think Dr. Grande did well. He talked about Jeffrey Dahmer's background. He did a good job. He had a lot of detail. He elicited what I think were important elements. So for example, that his mother was attention seeking, she was depressed, she had these histrionic traits, and she was psychotic at times. However, I do think it's crucial to look at his parents' presentation and their behaviours, but also their dynamic with Dahmer. Dr. Grande did this to a degree. He highlighted the turbulent relationship between Jeffrey Dahmer's parents, and he stated they eventually got divorced. And he also talked briefly about their attitude towards Jeffrey. So, you know, emotionally distant mother, they were both neglectful, all very good points. But he didn't really explore whether or not this could have contributed to Dahmer's behaviour. And after all, the title of his video is "Did Jeffrey Dahmer's life experiences contribute to his killer status?" So I emphasise the contribute because there's not much point in just highlighting the abnormalities without offering any kind of psychological or psychiatric analysis. To be fair, Dr. Grande did say a couple of things. He said that Dahmer maybe wanted to escape the situation with his parents arguing. He wanted everything around him to be quiet, so that was one of the kind of connections to his killings. But I don't think that Dr. Grande gave much consideration to all the other relevant factors. So for example, a huge one is, can personality traits be genetically inherited? So scientists estimate that around 20 to 60% of temperament is determined by genetics. So what I'm saying is it's very possible that Jeffrey Dahmer inherited some of the traits from his mother, like depression, aggression, and we all know that personality is both nature and nurture. So what I'm saying is I'm sure it's a combination of some genetics, plus probably more importantly, the environment that he grew up in. The other thing is that Dr. Grande didn't seem to figure out that there was some suspicions that Jeffrey Dahmer was psychotic. It was one of the diagnoses that came up in his trial, even though it was eventually rejected. And of course, psychosis is absolutely hereditary. It definitely runs in families, although it is multifactorial. So moving on, Grande highlighted some important issues from Jeffrey Dahmer's backgrounds that are relevant. So he said that Dahmer was obsessed with animals and animal bones and had his own animal cemetery. Very true. He said he was attracted to death. And I think all of this is really important. Although I don't think Grande really went to explain the connections. So he didn't really explain that Dahmer's morbid fascination with the human body was, I think, part of the pleasure that he took in dismembering them and also collecting their remains. So he would keep like skeleton parts as a souvenir. So I think that's all kind of connected. Grande highlighted that Dahmer was desperately lonely and he wanted this like connection to people. He didn't care, in Grande's opinion, if they were dead or alive, and I think that's probably true. But Dr. Grande omitted to mention that the main mechanism, in my opinion, the reason why his loneliness is relevant is because he would have felt disconnected to the community, to society. Dahmer would have felt isolated. He would have felt like marginalized. Why is that important? Because it results in this massive inferiority complex. And that is very common in killers. And I believe that is one of the main issues, one of the most important that would have driven his behavior. Grande mentioned alcohol, and he said that alcohol disinhibits people, which is true, fair point. Jeffrey Dahmer did have dependent syndrome. But I think he could have expanded by saying that alcohol is seen in well over 50% of murders, and for people that already have aggressive or violent tendencies, alcohol kind of decreases the threshold for them to discharge that. So it makes it more likely that people will act that way. So usually people have some degree of restraint, that little voice inside, and alcohol can help them overcome that last hurdle to actually act in a violent manner. Okay, so those are the areas that Dr. Grande did quite well in, I think. Areas that Dr. Grande completely missed. I have to say some of these I think might be quite obvious to professionals who assess mentally disordered offenders for a living. Some of this is bread and butter risk assessment. Dr. Grande mentioned that Dahmer was unsuccessful. So for example, academically he struggled at college. He attended Ohio State University. He dropped out after one semester. His GPA was 0.45. Moving on from that, Dahmer enlisted in the army. He was discharged soon due to his alcohol use. He had a job as a phlebotomist. He was fired after 10 months. So it's almost like Dr. Grande had all these clues. He had all these pieces of the puzzle, but he didn't reach what I think is an obvious conclusion, which is Jeffrey Dahmer, because of these experiences, would have experienced a massive inferiority complex. He would have had this core belief, which is that other people are better than me. I am worthless. And that is actually very common in serial killers. They tend to have this fragile ego, this sense of entitlement, this narcissism. So they feel worthless for all these reasons, Jeffrey Dahmer, all these things that he's failed in. And this rage would have built inside of him, and he would have taken it out on all of society. The other thing that I think Dr. Grande failed to mention is, or he mentioned but he failed to put together, is Dahmer's previous offences. So he got charged with drunken disorderly more than once, indecent exposures. So you've got to piece together the dots when you do a psychoanalysis. And I think this is relevant because it shows criminal versatility, which is often seen in psychopaths. I'm not saying Dahmer necessarily crossed the threshold for that diagnosis, but it certainly indicates antisocial personality disorder. So people with that disorder have these pro-criminogenic general attitudes. So what I'm saying is they don't care about the law. They don't accept normal human behavior, society's kind of restrictions, normal boundaries. They have a lack of empathy. So all of this criminal versatility, I think, reflects Dahmer's antisocial tendencies. And that's relevant because this diagnosis massively increased the risks of future violence. Another huge area that Grande neglected to mention was Dahmer's sexuality. So Dahmer was openly gay in a time where people were shamefully, openly homophobic, especially in the United States at that time. So we're talking about the 80s and 90s, the AIDS epidemic is in full swing, there's nationwide homophobia, there's a lack of support from Ronald Reagan's administration. In fact, Pat Buchanan, Ronald Reagan's communications director, described AIDS as, and I quote, nature's revenge on gay men. So I think this is relevant because it would have made Dahmer feel like a second-class citizen. It would have added to his insecurity, his inferiority, his internal rage. And kind of connected to that, Dr. Grande said that Dahmer didn't have any specific reason to hate his victims. Completely disagree with this. In fact, one of the expert psychiatrists in his trial suggested that Dahmer targeted his victims as he felt ashamed internally of his sexuality, so he wanted to attack that unacceptable part of him in his victims. So just to kind of put this all into context, I just want to be crystal clear. None of these factors excuse Jeffrey Dahmer's behaviours. This is just an explanation. So if you want to know a bit more about his psychoanalysis, see my other video on my channel expanding on the potential psychiatric diagnoses that Dahmer had, what my thoughts are on all those diagnoses and whether that made him criminally culpable or not. But I'm not going to go into all of that, but I will say that violence is multifactorial. So there's something called the Swiss cheese theory, which is that Swiss cheese has lots of holes, and if the holes line up, they have to all line up exactly perfectly for something to be able to pass through. In that same way, for somebody to commit violence, especially extreme violence like killing, especially serial killers, there's so many little factors that have to line up. And no one of these individual factors will cause violence. So, for example, people who struggle academically, people who struggle with their sexuality, the vast majority of those people will not be violent. But you mix in all these factors, you mix it in with a turbulent childhood, you mix it in with the fascination of animals and bones and bodies, you mix it in with some personality disorders, then it all kind of connects together. So, my final thoughts are this. I throw shade at Dr. Grande, I have done in the past, but credit where credit is due. His aim, according to the title of his video, was to explain the life experiences and how they contribute to Dahmer as a killer. And I think that Dr. Grande did pick out a few key areas of psychoanalysis. As I said, he did well to describe his obsession with animals, animal bones, his attraction to death. I think that was very well done. I think Dr. Grande also missed a few key, obvious areas, or he mentioned them, but he didn't put the dots together. As you might know, I've had previous beef with Dr. Grande. See my previous videos, I'll put the links in the description. My main beef is that I believe he's been misleading viewers by the very fact he calls himself and his channel Dr. Grande, but his PhD is in counselor education. He's not qualified as a psychiatrist or psychologist. After making these videos, I've had literally hundreds of comments saying that some people are supporting him, which is absolutely fine, but hundreds of people saying that they assumed that he was a psychiatrist or a psychologist, which kind of exactly proves my point. Anyone can make YouTube videos, but I think they need to really clearly explain what their expertise are or aren't, so they don't mislead people, and in cases where they get things wrong, as he has done a few times here, they're not miseducating people, even if it's by accident. By the way, I don't think that his psychoanalysis of Jeffrey Dahmer was anywhere near as bad as Dr. Grande's psychoanalysis of Chris Watts, of which he made many mistakes. See my video about that if you're interested. I'll also put the links in my video. So all I have to say, stay euthymic. Please do not forget, I love you.